All right. Well, I think we're going to go ahead and get started. So hi, everybody. I'm Dr. Audrey Riffenberg, coming to you from Albuquerque, New Mexico. I'm the president and founder of Health Literacy Connections, and I've been a health literacy trainer and consultant and coach and plain language materials developer for about 25 years. And during that time, I was the health literacy leader at an academic medical center for several years, where I was charged with implementing all kinds of health literacy things in the organization, which of course required in the beginning that I figure out how to sell health literacy. And I'm a health literacy expert, I'm not a salesperson, so it was really challenging for me. But over the years I was there, I figured out a lot of stuff. But I was still so curious about it, I decided to do my dissertation research, interviewing people around the country on how did they implement health literacy in their organizations, but also how did they sell it. So what I'm going to share with you today is 7 strategies that I learned personally, that I've learned from my coaching clients, and also from those folks that I interviewed for my research. 7 strategies that we know work. So when this conference went to virtual and we got our time cut, I thought, oh gosh, I have a lot of strategies and I wanted to maybe cut a few, but couldn't figure out which ones to cut. So we're just gonna go through pretty quickly, and I'm giving you with resources at the end. So let's just start with looking at what is making the case for health literacy. So it's really selling its importance and its value, helping people move their mindset from resistance and apathy to, you can probably imagine, you may have even heard people say, oh great, one more thing to add to my plate, one more box to click. Moving them from that space to a different perspective where they say, hey, this health literacy stuff could actually work, could help us. So getting them to buy in. So making that shift is what making the case or selling health literacy is all about. I just want to start with, there's 2 common mistakes that I made and other people that I've worked with and talked to have made. And I just want to get you thinking about not doing them from the very beginning. So not building the case before trying to make the case. And so you might be going, well, what does that mean? I'll talk about that distinction in just a minute. And then not using available resources. So I'm going to say it now and I'm going to say it again at the end. These 3 resources are some of the best things that you can have as you learn to build the case and then to make the case. So let's go into that distinction. So building is like gathering your knowledge, your skills, your data, maybe doing some assessments, finding your champions and other support in your organization. So just getting yourself up to speed, learning about your organization, maybe doing some little pilots for some data, and getting some assessments in place so that you have something to talk about. So that's the building the piece. And then making the case is like moving into the building or being ready to show it off. So the making the case is presenting or explaining or sharing the stories, sharing the data, the persuading and selling that you need to be ready to do. That's a common mistake, to not do one before the other. So these are the 7 strategies. And again, I thought that's a lot, but I didn't want to drop anything because they're all really powerful together or even separately. So let's jump in. So the first one is finding stories of avoidable struggles or results, health outcomes. And what I mean by stories is like examples or reports of things that have happened that didn't have to happen, and that were due to things like poor communication, misunderstandings, teach back not happening. So those kinds of things that have happened because of something that health literacy strategies could address. Also, stories are really good for engaging the heart. And that's the first thing that we want to do when we're presenting to people, is we want to engage the heart. So if we have some story about something awful that did happen or almost happened, it can be very attention getting and can engage the heart. Stories from within your organization are the absolute best if you can get them. But sometimes people are a little nervous about sharing stories about things that have happened or gone wrong. And so it may be hard that you may not want to share that information. So places that you can go to try to get that information is maybe to go to your legal risk people or to a patient advocate or ombudsman's office, or if you have a patient safety network kind of system where people go to report potential harm, talking to the people that receive those reports and look through those for problems. So you want to make sure that everything is de-identified so no one can actually say, oh, I know where that happened, so-and-so did that. No, because the minute you have a story like that, if you use it without de-identifying it, you lose your credibility and nobody will share with you anymore. So the bottom part of the slide is about a general principle, the heart, head, heart. And this is when you're gathering information, you want to be thinking about, is this heart stuff or is this head stuff, the kind of the cognitive? The heart is where you want to start your presentations, then move to the head or the cognitive, the statistics and that kind of thing, and then move back to the heart. And this is a great principle from some terrific people called Language of Caring, and I'm using it with their permission. So if you can't get stories from within your organization, you can use videos, and there's lots of videos online. This is a good one. This is one of my favorites. If you're choosing videos, you can use this one if you want to look for some others. Be careful that you don't choose something that features only or primarily people with limited literacy skills or people with language barriers, because then it's easy for people we're trying to teach about health literacy to say, oh yeah, those people have issues, we already knew that they did. But we want to make sure that they understand that any of us can have low health literacy at any given point, regardless of our literacy skills. So just make sure that you don't show and feature primarily those folks. Another place to get some great scenarios, or these are just little scenarios, not necessarily stories, is at this website. They came from this terrific book called Scenarios for Success. It's no longer available in hard copy, but they have put it up in PDF, not PDF, but the publication format, I don't remember what that's called, at this website. So you can download it, and it's not really in a format that you can download and hand out to people as a booklet, but it has terrific stories in it and things, scenarios of confusion and misunderstanding and the outcome of those. So check out that website. And if you do use it, it'd be great if you would send an email to Luz Maria Castillo, who's one of the developers of the book. And she likes to know when people are downloading it and using it, so she can make the argument in her organization to leave it up because it's being useful. All right, stories. Second strategy is looking at and presenting the extent and the impact of low health literacy and low numeracy. And you'll notice the brain on the side of the slide, because this is where we're getting into the cognitive stuff, the logical, the statistics. So we want to show the statistics on health literacy nationally, for your state, and locally as much as you can. These are two sources to use. You probably already know about them and maybe are already using them. What you may not know about is this cool health literacy data map. I added try it up here on the top of the slide because it didn't work last week or this week. It's still up on the website, on the internet, but it's not working as an interactive map, which is how it was most useful. So I don't know if it's down or just temporarily, or if they've taken it, they haven't taken it down per se. So I don't know for sure, but you might just try it every once in a while and see if it's working again. It is a very powerful map if you can get it to work, because it gets you into the smaller local level. Like I'm down here in New Mexico, right above the word interactive, and you can see how much red there is, and red is the lowest quartile. So when I present here in my own state, it's very easy for me to say, look at where we are, we've got to address this. So here's an example of the impact rather than the extent. So if you can talk about various studies or things that we've learned from studies, this is a more current study of COPD patients that showed people with low health literacy have these things: less knowledge, more trouble understanding complex information. They report a poorer health for themselves, and they're at higher risk of ending up in an emergency department or being rehospitalized. So those are all things that are not good. We don't want those things, and they're all associated with low health literacy. So sharing that kind of information can make people really pay attention. Here's a more comprehensive version. This is a literature review of a whole bunch of different studies that was done in 2011. And it's still, even though it's older, it's still the most recent one we have. And it shows that low health literacy is consistently associated with, as in the study I just looked at, more hospitalizations, greater use of emergency care, lower receipt of mammographies and flu vaccines, screenings and vaccinations kinds of things, and among elderly persons, higher death rates. And there's the link to that literature review as well. You can download it. So showing this kind of information is very helpful. Someone just put in the comments that the Health Literacy Map site is active. Yay, thank you for that, Debbie. Woo, that's great, because it is the coolest thing. And I was really bummed out when I saw last week that it wasn't up. So awesome, that's great. All right, so the third strategy is to do some kind of baseline assessment. So have you done an assessment of any kind? If you haven't, these are some ideas of what you could do. You could start with a PDSA, which stands for Plan, Do, Study, Act. It's a cycle that people use, organizations use for process and quality improvement, sometimes unit-wide, sometimes smaller, to test a new process or a new way of doing things. So you could recruit people and set up a PDSA and then share its results. Something even simpler and more basic is just analyzing the reading level of, say, the 10 most commonly used documents in your organization. If health literacy is not even on the minds of anybody and it's just beginning, you're trying to get it to kind of come to the surface and people even begin thinking about it, showing the mismatch between your most commonly used documents and the average reading level of US adults can be really helpful. Speaking of documents, if your job entails reviewing and editing documents, and that's something that people submit to you, you can also record what's the demand for those services at a certain point, and then say, is there a change in demand? Like in our organization, it was kind of slow in the beginning, but the more people learned about it, the more and more documents we got. And so we were able to document that and then get a second person, a second health literacy position created because of that documentation. You can also do a large scale formal assessment, and there are several different versions of those out there. But in order to get the support across the organization to do something like that, you generally have, you need to have already kind of sold health literacy to a fair number of people. So this is really good if you've got that data, but it's probably not a place to start if you're just beginning to try to get health literacy awareness going in your organization. And it just occurred to me, I didn't say at the beginning that I'll be taking questions at the end the best I can, because there's a lot of folks here and a lot of questions will probably come in. So I'm not ignoring you, I'm just not going to take the questions till the end. Strategy number 4, pilot projects and hopefully other successes. If your pilot projects were successful, hopefully they are. We did some that weren't so great. So places to start for pilots is, again, that PDSA, and there's a little graphic of that cycle, the Plan, Do, Study, Act. It's a great cycle. It's part of this overarching model called the Model for Improvement. You can find places where you might do a little before and after change with a PDSA cycle and do something that you can measure. A place to start might be imaging services. Colonoscopy prep instructions are often pretty difficult and to follow and they don't work all that well. And then what happens if people don't come in clean because they couldn't understand the prep or didn't do it correctly, is then you've got a room full of staff and the equipment and the staff in the room all being available and ready, but no patient. So that's a huge financial loss for the organization. So if you want to go in and get support for revising those colonoscopy instructions and do a little before and after, you can look at So how many people came in clean versus in the past, how many were not coming in clean with the new set of instructions. You can look at something like in respiratory services, maybe people teaching folks how to use their first inhaler. You could maybe teach those people that are working with the patients how to do a teach back, and then see what happens to the adherence with the inhaler use and whether patients understand that better. You could do a teach back training for mid-level providers on medication adherence, on how do you teach patients and then check with them on do they understand how to take their medication, and then track what is the result of that. Do more patients come in having the actual result of the medication that was intended or hoped for? So just in general, changes in readmissions, adherence, other types of things like that after an intervention are the kinds of things that you would want to be looking at. So then you're going to report on those pilot tests. And this is where, if you were in that phase of the process where you would show the case that you built. So this is the making the case. In order to do that, gathering the data that you've just gotten, and then calculating the potential cost and time and other savings, like with the colonoscopy, showing the results and benefits, maybe with a story, like maybe a story of a patient who had come in the past for their colonoscopy, but was told, well, you're not clean enough, you didn't do the prep correctly. And just after doing that whole prep said, forget it, I'm not gonna do it, and waited 5 years, let's say, to come back. And now they understood the instructions. Maybe they could say, well, that wasn't so hard. Why was it so hard last time? You could get a story like that to share, and that brings in the heart as well as the head. One thing to know about if you're working with staff who are doing a PDSA with you, designing it and then carrying it out, be sure to give credit to those people who've designed it and those people who've actually done the work, because that credit and giving those folks kudos is a great way to start building support for other people being willing to do that with you and for you. So then discuss, if you're talking about your reporting on this, discuss how we could spread that intervention, and then say exactly what you're suggesting we try next. Another one of the things that I didn't do very well in the beginning was I wasn't specific enough in my requests. I thought it was obvious what people needed to do, and it's totally not. Number 5. This one is so important. Remember at the beginning I talked about that, oh great, one more thing to do attitude. So this is the way to avoid that. If you can align health literacy and whatever health literacy work you're suggesting to ongoing initiatives or organizational goals that are already in place, that can be really, really helpful. So like down in the picture in the quote, we'd like to help you accomplish what you're already doing. Here's how we can help you. So you want to attach it to something that's already happening. And these are examples of some of the initiatives that are happening across healthcare organizations across the country. And you may be able to attach some health literacy work to any number of these. So just thinking about what's going on, and maybe you don't know yet. I was new to my organization. I didn't know if we had a patient safety or patient experience and satisfaction score initiative, if we were working on reducing readmissions for heart failure, which we were, but I didn't know that in the beginning. So doing the research to find out what's actually going on in your organization, that's all part of becoming, of building the case so that you can then make the case. The last bullet I put in here is if somebody's come before you and your organization's already said, okay, we're going to become a health literate healthcare organization, you're golden. You've got a really good start. And then all you have to do is refine the strategies that you're going to use as you present to others. Number 6, the whole money thing, cost savings and return on investment. It's really, really important. You can hypothesize the cost impact of something that was shifted because of a health literacy strategy, even if you can't get the exact numbers. So here's an example. Let's say there was an unreimbursed heart failure readmission that was avoided because the people who were doing discharge had been taught how to do teach back. So CMS is Centers for Medicare and Medicaid Services, and there's a specific list of conditions that Medicare does not reimburse for readmissions within 30 days because they want to encourage the organizations to have in place the follow-up and the discharge process to keep those people out of the hospital. And if they do have a problem, going to their primary care doctor first, like teaching a heart failure patient. If you've gained 3 pounds or more in one day, that's a problem. You need to call your primary care doctor. Don't wait 3 days and then end up in the hospital again. So that's the kind of unreimbursed readmission that organizations are trying to prevent. So the way to do that would be to calculate the savings by first finding the cost of that readmission that nobody's going to pay for but the hospital or the healthcare organization, and then multiply that by the number of readmits per time period that were happening before the teach back training, and use those figures in your presentation. So that's all head stuff, but then you can also talk about patient suffering. You can talk about that grandfather who didn't have to miss his granddaughter's birthday because he was in the hospital, or got to stay home and be at home where he can get his get his health under better control and just feel so much better being home. So that kind of takes us back to the heart piece. Here's a couple of examples of cost savings and return on investment from plain language specifically. So Cleveland Clinic was sending out billing statements and patients weren't responding. So they revised the billing statement so that it was in plain language and it was much better laid out and easier to use. And they had an 80% increase in patient payments. Imagine that, like, whoa, depending on how much they were owed, that could be massive, way more than the cost of your time revising the billing statement, right? And patients responded because now they knew exactly where to pay and how to pay and when to pay. And they could just see the bill, get it done, knock it out, put it in the mail, or go online and do it. So it really enhanced the patient experience and it brought in a lot more money to Cleveland Clinic. Another example is the Veterans Benefits Administration revised a letter that was they were sending out to veterans who had at some point given this name, a certain name as their beneficiary, but it hadn't been updated lately. So they would send out letters saying, could you please update your beneficiary information? And they were only getting a 43% response rate. So they revised the letter into plain language, put the important information at the top and so forth, and increased their response rate to 65%, which ended up saving the VA over $4 million in staff time of the staff being on the phone, calling these people to find out about who their beneficiary is. So if you're sending out, or your organization is sending out information to hundreds or thousands of people, the savings can be massive. So that's maybe giving you some ideas of a different way that you can look at offering your services and helping implement plain language within your organization. And these examples came from the book that's there that you see an image of here on the bottom. And it's full of examples of the cost savings, also with the Writing for Dollars, first part of the book. The second half of the book is information about how people like and prefer plain language. And there's none of this, oh, we don't want people to be offended. No, nobody was offended. So that's a great book you can get on Amazon. So how do you find those cost figures? Again, you try to get them internally. I had a real hard time getting figures for even a procedure that I was going to have within my organization. They just didn't want to give up the cost stuff, but my copay was going to be 10%. And I said, well, you know, to myself, 10% of 3,000 is way different from 10% of 300. Could I even just get a ballpark what that's going to cost? And it was very difficult. I finally did, yeah, it was it was hard. So ask internally first. If you can't get anything, these are some websites that you can go to and just hunt around in there and see if you can get the data that you need. These give kind of general costs or cost comparisons, like what does the hip replacement cost in your zip code versus that zip code, so that you're just more informed as a consumer. But this can also be helpful for you in coming up with numbers for your health literacy, making the case. So again, that's head stuff, but if you can go back down into the heart and find a story about a person with crushing medical debt. We know, you may know, that medical debt is the greatest cause of bankruptcy in this country. That may not be true after the impact of COVID, sadly, but for now, that's the statistic. So if you can get a story from a patient or about a patient and the debt that they have because they didn't understand when they were given information about the potential cost, or they didn't know how to ask their insurance company about this. So health literacy issues. A way to get those kind of stories is to go to the office that is sometimes called Patient Financial Services, the place where patients go to talk about, okay, what do they owe and how can they do a payment plan? Because those folks who work there, they've heard about all the struggles that people are having and can share with you some of those stories, again, completely de-identified, even blend the aspects and come up with a story that's believable and could be real. Okay, well, I'm going fast. I hope you're following. So number 7 is legal and accreditation and compliance. And this is stuff all in the head, right? This is all the cognitive piece. So showing how health literacy helps address these important issues can be really powerful. The legal risk and liability of malpractice suits is huge. Legal requirements for other kinds of things like providing documents in the languages of different populations with a certain threshold, accreditation requirements for your organization. Those can all be supported by health literacy strategies. The guidelines and regulations that come from Centers for Medicare and Medicaid Services, Health and Human Services, Food and Drug Administration, the Joint Commission, MACRA guidelines for payment, all of those kinds of things, and the ethical guidelines. So those aren't necessarily financial, although they can be, but they're still really related to things that the organization has to pay attention to or should and knows that they should, and so therefore probably will. So for this kind of information, see this source down here. We'll talk about that in just a minute, Building the Case for Health Literacy. Workshop Proceedings from 2018, great resource. So I'm going to pop down into the malpractice here for a second, a little deep dive. Malpractice related to poor communication. So in 2015, there was an analysis done of all medical malpractice claims, and it was all put in a big database. Over 30% of those claims related to communication failures. Now, some of those were among providers, and some of those were between patients and providers. So of the cases that involved patient and provider communication, that was over half of those cases involved them. And those types of claims, the patient-provider problems, incurred $935 million in legal costs for the organizations that are in the database. So that is pretty powerful information to share with your legal team or leaders at a pretty high level. And interestingly, 3 of the top 4 causes of malpractice claims were these: inadequate informed consent, inadequate medication education, so somebody might have been hurt by their medication, and incomplete follow-up instructions, either from an ambulatory visit or a discharge. So guess what? Our strategies can address all of those causes beautifully, right? So perfect place for you to go and say, you know, the malpractice claims information shows that, and we can help with that. So it's, again, there may not be a big initiative yet, but if you can find some way to get in and say, you know, we could help with that informed consent and head off some malpractice claims. So that's, again, very powerful information. Another legal resource is this wonderful article. This is just the top of the article. It's by Christopher Trudeau, our health literacy lawyer in the field. You can get it at that link, and it's great for 2 things. One is make a copy and hand it to your legal people that are saying, oh, we can't write it like that, or whatever their objections are, and read it for yourself so that you can get the language and the way that we talk about some of these issues. You can have those in your head and be ready to just let them roll off your tongue, right? So this is a great article. Nice quick read. So I want to come back to the heart, head, heart principle. And let's assume that you're finally ready to make the case. You've built it, you're making it, you're doing a presentation, and you're going to state exactly what it is you're asking for. Be sure that in that presentation, you end with the heart. So we've talked about starting with a story, maybe embedding stories in the middle, doing some head stuff, but end with a heart. Either tell another story or describe a new reality, some kind of vision that people can see where things are different. Because I know healthcare providers that are not happy with the way their patients are not complying, let's say, in their minds, not adhering to what the doctors have told them to say. And if they can picture how it would feel like, so how would it feel if 50% more of the patients that you give a new medication to came back for their next visit saying, it worked, I feel great. And you could say, well, how are you taking it? And they would tell you exactly how you told them to take it. How would that feel? What would it feel like if you knew, because you were doing teach back, that you were certain now that your patients got it, that they understood? You thought they did before, but then when you started doing teach back, you discovered they really didn't. And now you know you have a way to make sure. How would that feel in terms of your satisfaction with your day? So something like that can be really helpful. So now again, moving to when you're presenting your case, just some tips here. Getting an MD or someone in a pretty high leadership, maybe someone in the C-suite, to co-present with you can be super powerful, because people listen better to their peers, and it will give you a lot of leverage because there's somebody standing next to you who believes in your cause and is promoting it with you. If you ever get the opportunity to do that presentation to the high-level leaders, or even just managers and leaders in general, like we had a group of about 100 people that were in top leadership and management that would meet every week. Dress like you mean it. I mean, dress like most of them do. Really spiff it up, and then speak with conviction and step into your leadership, which is a phrase that I love. It's just like you know that this is the right thing to do. You know how it can benefit the organization, and we just have to get them on board. So really preparing and being ready to say, guys, we got to do this, and here's why. And the here's why part is where you'll find your power. So talked about a lot of things, and maybe now you're thinking, oh gosh, what should I do next? So here I posted two additional handouts besides the slides. And the first one is a self-assessment for you to go through that will ask you about these strategies. What do you know? What else do you need to know? Where do you feel confident? And then a little bit about your organization. So this is a good next step, is to say, okay, where am I with this whole process? Where do I need to grow? And so you can pull out some ideas for what you need to learn, or what you need to investigate. Like say, okay, well, I don't have any stories. So I need to go to my task force or my champions and say, hey, can you help me figure out how to get some stories from people in the organization? So it'll give you some ideas of kind of where your weak areas are. The next one is a planning worksheet. That is what we would have done in person if we'd been in the in-person conference. And that is, what should you do next? So it's just a worksheet for you to think through and prepare. Okay, we're strong in this area, but I know this initiative that I haven't really been paying attention to. Maybe I can go talk to those people. So you'll come up with a specific plan of what to do next. So these two worksheets should help you quite a bit with that. And I would recommend that you take this assessment, the self-assessment, maybe every 6 months, put it in your calendar, save a blank copy, and take it every 6 months or so, a couple times a year, just to see how you're growing and see over time, wow, I'm really getting better at this. So skill up, do your homework. And what that entails is get to know your health literacy, the data, the statistics, and so forth in your area and nationally. Get to know what's happening in your organization, build those relationships and that support, go out and schmooze and network, and then find out what's important to those other people. Like, what initiatives are they working on? goals are they supposed to be reaching that maybe health literacy could help with? So all of this is that building the case first. And then when you've done that, customize the presentation to the audience that you're speaking to. You use these resources to do that, and you practice your presentations with a mentor or champion, somebody at the leadership level, ideally, that you'll be presenting to, so they can say, oh yeah, don't say it that way. That's not how we say it. Here's how we say it, right? So practice with a mentor until you're confident, until you can really step into your leadership and have that feeling of, okay, I got this, right? So stay persistent, find your grit, like this little piece of grass. I felt like I was trying to push up through some cement, but I was making cracks and finding the cracks, and finally did get up there and was able to grow a little bit. So it is kind of a marathon, not a sprint. So we do have to just keep finding our grit, because you're going to get a lot of no's. But the more of these strategies that you learn how to do and use, the easier it's going to be for you. So these key resources, you gotta get the resources. I can't tell you, I've been talking to coaching clients and they're stumbling around, and I say, well, did you download Appendix C from this building the case thing? Did you look at Appendix C? Like, I'm thinking, why are they struggling? And they'll say, no. And I'll say, you gotta go get it. It's free, just download it and look at it. So this building the case for health literacy, it's the proceedings of a workshop. I was on the planning committee for it and I spoke at it. We really thought through, how do we bring together kind of what's known about how we build the case for health literacy, and then how do we make the case for health literacy? I presented on my dissertation research. Other people presented on what they'd been doing in their organizations. It was really good. The proceedings, of course, it's then put into a book that you can download for free. You might not want to read the whole thing, but each speaker's presentations are kind of summarized into narrative there. You might just want to jump to the appendices and go to Appendix C as the first place to start. It's got great abbreviated resources for you. I even gave you the page numbers. Don't miss it. It's just, oh, so important. All right, here's another resource we looked at earlier. This focuses on the benefits of plain language in multiple different industries. Professor Kimball, Joseph Kimball, he was for his whole career a law professor and a plain language law specialist in the international plain language community. I met him in that community about 25 years ago. And we knew that if you had examples of cost savings, you were supposed to give them to Joe. And he collected them and then compiled them all in this book. So he's got incredible credibility, have spoken, in all these different countries. And really, this book, if you have a legal team that's kind of worried about what you're doing, buy this book. Get your organization to buy a book for every person on your legal team. I did that, and it transformed how they saw things. All right, another great resource is this Building Health Literate Organizations Guidebook. You may have seen it. Dr. Marianne Abrams is the primary author, and she's done some sessions on this at the IHA conferences in the past. We wrote this, well, it came out in 2014, so it's kind of old now. Some of the links don't work, and we'd love to do a second edition, but we don't have the funding for that at this point. But it's still a great, solid book full of information and ideas. Again, like the workshop proceedings, it'd be great for you to read the whole thing. Actually, this is more important than reading the proceedings. But you can start with chapter 4, which is the chapter about this topic. So again, it's a free download. Just download it, just get it, and then read it. Don't just get it, but get it and read it. Is just really helpful. All right, so now you're probably thinking, oh my gosh, there's all these resources, all these strategies. You might be thinking, I don't know where to start. So if you would like some help creating your plan, excuse me, I invite you to sign up for a 45-minute complimentary consultation that I call Making Your Case Mini Plan. And I'm offering 7 of those. I've opened up just 7 slots I was able to open up in August. And we'll go through that plan. If it seems like a good fit and it's been helpful, we can talk about how to work together further. If not, that's okay too. Go to this link, this calendly.com, that's my calendar link, and just sign up for when it's first come, first serve. If you get there and they're already gone, then just shoot me an email and tell me that you'd like to be on my waiting list for when I open one up next. Also, shoot me an email if you're interested in, I'm thinking about putting together a group coaching program on selling health literacy. Don't have a firm idea of that yet, but if you're interested in maybe getting in a group coaching program for that, or you just want to be on my mailing list, go ahead and shoot me an email and tell me that as well. So before we do the questions, I just want to make an announcement so I don't forget. The conference organizers asked me to do your plenary, remind you if you did go to this morning's plenary, if you would go in and do the survey in the engagement center page. That should be up by now, and then they're going to take that and give us the results on Friday and get information about how you can collaborate after the conference. So just wanted to make sure I told you that. And so now I'll do some of the questions, and then of course there will be an evaluation for this session too, and I would really appreciate your feedback. So if you can take time to do that as well, that'd be great. So we have over 500 people here, so I won't be able to answer all your questions, I'm pretty sure. But let me just go over here and I answer them verbally. So this one says,
and excuse me, Audrey, just to give you a
yes.
heads up, we have a 6-minute time check. So I know we have many questions and probably won't get to all of them, but enjoy and make it count. Thank you.
All right, I sure will. So yeah, this first one is about, have I worked with agile teams in companies, website and app developers, designers, product owners to try to sell them on the value of the user experience? No, I have not. I've been working for years trying to just sell my clients on the value of doing audience testing. I've never gotten into this particular group, but it is, oh gosh, it's convincing people to do user testing or this kind of audience research can be really tough. And yeah, I don't have any magic answers on that one, so sorry. Okay, this is a question that's not, I'm not gonna take time for that one right now. It's about picture graphics. Okay, do orgs need to pilot things like improving colonoscopy? Yes, definitely. Okay, yeah, hi Jerry. So Jerry Lynn's asking about, do we need to pilot things like improving those colonoscopy prep instructions? Yes, and thank you for pointing that out. I didn't say that, but of course you would want to redo those instructions first and then do a little mini test, do some audience testing with them for making sure that they do in fact communicate better before you do your PDSA cycle and use them on the floor, so to speak. So, oh, and there was more to that question, but it just disappeared. Yeah, and the last part of her question was, why don't organizations believe their data? Yeah, good question. I'm really not sure. I don't know whether they don't think it's been achieved in a proper way, but I think working directly with your quality improvement people can really be helpful because they know how to design things in such a way, process improvement or quality improvement, PDSA, Lean, Six Sigma, folks that know about that stuff, because they are better at helping you get the right data and then presenting it. So that would be a good resource. Yes, here's a good point. Chris, thank you, Chris. To align with organizational initiatives, she's suggesting it might be good to talk with your human resources or your benefits people to find out if there's any new needs or new regulations that they need to address. That could be also helpful. Okay. Yeah, Jerry Lynn again talking about another aspect of the hard emotions and talking about the clinicians and providers. I did mention that right at the end. Okay. Yeah, Stephanie's talking about, she's been working on health literacy, trying to build support in her organization for 12 years. But they keep getting new leadership, and every time new leadership comes in, she's got to start the teaching again, and she loses ground. It's exhausting. Yes, indeed it is. And I don't know what to say besides just documenting everything the best you can, keeping your old slides for the data that you've got, maybe getting fresh stories, trying to set up individual appointments with those folks to offer to help get them up to speed on what you're doing, that kind of thing. But yeah, it is really, it's a continuous process. It's like that marathon versus sprint that I was talking about, where there's turnover, not only leadership, but throughout your organization. And so you're going to have to always be building the case, teaching people, you know, and the more you can get other people to help you with that, spreading the word by doing PDSAs with them, or just getting them to understand health literacy, getting them excited about it and letting them talk about it too, that will help diffuse that information. But with your leaders, you probably are just going to need to keep teaching them. All right, let's see. Another one here where she says, we have a brand new leadership team now. She's currently in the process of building, and wondering if I have a recommended way to get in front of them to make the case. Yes. That, one of the things that I found most difficult was I was putting together all this data, but then I couldn't find a place to deliver it. And I really needed to work on finding out about these informal communication channels that happen throughout the organization. And let's see, Kelly, how are we on time?
Time has expired at this point.
Oh, it's expired. Okay.
Sorry.
Yeah, all right. My timer just went black. So let me just finish that question. So yeah, learning how communication happens, who talks to whom, what committees are meeting when, how to get invited to them, finding out who is the secretary for a key leader, how do you get on her good side? A lot of it is just the networking and figuring out how do you get in. And that can also be exhausting and tough, but that's part of the kind of the building, is figuring out who's who and how you can approach those people. So, okay, the email to contact is on the very first slide. It's ar@healthliteracyconnections.com. And it's on the first slide. So, okay, well, that's, yeah, that's our time. So thank you so much for coming. Like you see in red at the bottom of this last slide, go make your case. Good luck, build it and then make it. And if you do want to sign up for that little session, be sure and do that. And I just wish you all so much good luck and progress in this, because as we know, it's critical to sell this health literacy. Almost nothing else happens unless we can do it. So go get them. Thanks so much for joining me today. Take care. Bye.